Canadian Blood Services has recommended that Health Canada end the ban on sexually active gay men donating blood. The proposal is backed by research suggesting donor screening should instead focus on high-risk behaviors, including having multiple sexual partners, regardless of a person's orientation. Canada introduced a lifetime ban for gay men in 1992, partly because of HIV. In 2013, it allowed blood to be accepted from a man who abstained from sex with another man for 5 years. The waiting period dropped to 3 months in 2019. And with us to discuss what the newly proposed changes could mean is Dr. Stan Houston, Professor of Medicine and Public Health at the University of Alberta and Director of the Northern Alberta HIV Program. Dr. Houston, welcome to Forum Daily.
Thanks very much for having me.
So we have a lot to unpack here, Doctor. Let's start with the current donor criteria for blood donation by gay and bisexual men compared to others.
Okay, well, you know, I think the situation has changed profoundly since the 80s or 92. I'm not quite sure what the rules were before 1992, but there were very strict rules from the first recognition of HIV. But a lot of things have changed. So first of all, the implications of the disease have changed profoundly, and I think the public perception has followed that more or less. So HIV was not only correctly recognized as a fatal disease back in the day, but it carried a special emotional, psychological load as well. And now, of course, not that I would ever want to make light of HIV. It's definitely better to prevent it. But someone who's diagnosed early with HIV can have essentially a healthy, normal life expectancy, taking usually just one tablet a day. And I think the public has kind of caught on to that. And of course, the tests that we have available now are way better than back in the day. And we've got a lot of experience with the tests and their efficacy.
All right, Doctor, let's go over this newly proposed process by CBS. What would this process look like, and what are your thoughts on this from a scientific perspective?
Well, the process is that gay men would be treated like other Canadians if they apply or offer to provide a blood donation.
All right, sir. And taking a look at the science behind this a little bit more in particular, what do we know so far about the likeliness of blood-borne diseases like HIV and AIDS being transmitted through blood donation in particular?
If there were no protections in place, testing, the risk is very high. If you have someone with HIV infection that donates blood, the risk of transmission is close to 100%. But the point is that we now can identify and therefore exclude individuals who are infected with a very high degree of efficacy.
And I guess one of the bigger questions here would be whether the sexual or gender orientation of a person has any impact on the risk of sexual transmission of HIV in the first place, Doctor.
Yeah, exactly. I mean, when you think about it, it's kind of illogical that an individual, a heterosexual individual who might have quite risky sexual practices, although they might not perceive them to be that risky themselves, or possibly to have a risk they weren't aware of. For example, to have a partner who was a past injection drug user or immigrant from a country with high rates of heterosexual HIV. So that person would be allowed to donate, and someone who might be in a monogamous gay relationship would not. And that's kind of not entirely logical, and it's kind of discriminatory.
Dr. Houston, thank you again for your insight into this on Forum Daily, sir. Thank you for your time.
Okay, thanks for your interest. Bye-bye.